Among many things, what we eat has a major impact on our health status, weight, and actually how we feel overall. As mentioned, the typical diet in our modern world is full of highly processed food and lacking in those vital nutrients. Our specific nutrient requirements will depend on several factors like our age, gender, how much we exercise, and other personal health circumstances like pregnancy or serious health concerns. While the amounts and types of nutrients we need can vary from person to person, most of us are likely not reaching our daily requirements for a number of vitamins and minerals. Nutrient requirements are determined by the amount of a vitamin or mineral needed to minimize a nutrient deficiency based on our age, gender, and several other factors. Each gender and age group has a specific set of general nutritional requirements that will help keep them healthy. The estimated average requirement, or EAR, will allow an individual to compare their nutritional intake to requirements based on their age and gender. This chart shows the amount of American adults who are not reaching their daily nutritional requirements for specific vitamins and minerals. At 94 and 95%, a majority of American adults are not reaching their daily requirements for vitamins D and E, two of the fat-soluble vitamins. Nearly half of Americans or more do not fulfill nutrient requirements for magnesium, vitamin A, calcium, and vitamin C. The RDA is neither a recommendation nor an allowance, but rather an adequate intake amount. The RDA for protein is based on analysis of nitrogen balance studies. Therefore, the RDA for protein is the amount of protein needed to avoid a negative nitrogen balance. This criterion creates two primary problems. Number one, a misunderstanding of what the RDA actually means. And number two, the RDA for protein is not based on a health outcome. The current recommended dietary allowance, or RDA for protein intake, is 0.8 grams per kilogram of body weight per day, or about 68 grams for a 150-pound adult. This amount of protein is probably not enough to maintain muscle mass, and we really need to be eating 1.2 to 1.6 grams of protein per kilogram of body weight, which is likely optimal for muscle protein synthesis, especially as one ages.